Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.
Support comes from Thomas Nelson Community College, now becoming Virginia Peninsula Community College, the first choice to start a bachelor's degree since tuition is 1/3 the cost of four-year schools. More at tncc.edu.
Hello, everyone. I'm Barbara Ham-Lee. Confusion, chaos, protests all over Governor Glenn Youngkin's executive order making mask wearing optional in schools. What's at stake? The safety and well-being of our children and educators, not only from coronavirus, but also from the stress of being bullied or ostracized for the choices individuals make. What does the science say about mask wearing? And speaking of masks, is it time to ditch the cloth mask? All things coronavirus with Dr. Keith Newby. That's next on Another View after this local, regional, and national news from NPR and WHRO News.
Discussing today's topics from an African-American perspective, this is Another View.
Hello, everyone, and welcome to Another View. I'm Barbara Ham-Lee. Before we start our conversation on all things Omicron with Dr. Keith Newby, let me take this time to invite you to the next Another View Race Let's Talk About It Town Hall. Now, it will be virtual on Thursday, February the 10th, 2022 at 6:30 p.m. We will have a distinguished panel of experts to help us understand the educational divide between students of color and white students and what we all can do to help close the gap. So I need you to go to whro.org/community and register. It's free. It's open to everyone. And I cannot wait to have a conversation with you. So it will be virtual on Thursday, the 10th of February at 6:30 p.m. Go to whro.org/community and register, and you will be sent the link to join our conversation. So 7 school boards this week, including Hampton City Schools, sued the Youngkin administration over the executive order the governor signed making mask wearing in schools optional. Parents of students in Chesapeake Public Schools have also sued the governor, saying his plan goes against CDC guidance and Virginia state law. This while the Omicron infection rates are still sky high, and even those who are fully vaccinated and have their booster shots are experiencing breakthrough cases. Here to talk about the science and mitigation efforts we all need to keep in place to stop the spread of coronavirus is cardiologist and director of health equity for Sentara, Dr. Keith Newby. How are you, Dr. Newby? He's not with us yet. Okay. We are waiting for Dr. Newby to join us, but we will be talking about wearing masks in schools. And I'd love to hear from you to hear whether or not you are sending your child to school, if in fact your school district has decided to make it an optional opportunity. That number is 440-2665 or 1-800-940-2240. Give us a call. We would love to hear whether you are sending your child to school without a mask, with a mask, encouraging them to keep their mask on. How are you handling this as school divisions around Virginia grapple with whether they will follow the governor's mandate or executive order, or whether they will continue to follow CDC guidelines, which right now says that students should be masked in schools. 440-2665, 1-800-940-2240. And now I think Dr. Newby is with us. Dr. Newby, did you leave somebody on the table, on the operating table? Is that what's going on?
I'll tell you, it's the downside about being a cardiologist. Everybody wants you right then. So I'm out there trying to tell people, listen, give me a few minutes. I got to go on this radio show with Barbara.
Well, as long as you didn't leave somebody with
No,
open heart surgery on the table, I'm good.
I ain't do that. We're good.
Oh, gosh. Well, thank you for joining us today. I know that you were super busy, but, we also know that this is our opportunity to really spread some scientific information about what is going on with Omicron, what is going on with coronavirus. And I know that the school divisions right now are really going through changes. I'm wondering what your reaction was when you heard that Governor Youngkin had signed the executive order to end the mask mandate in public schools, particularly since you serve as an advisor to some schools in the area in terms of mitigation efforts for coronavirus.
Well, this is the bottom line. I disagreed with the drop of the mandate. I know some people may get upset hearing that, and to be honest with you, I don't care. I tell you why I don't care is because my job as a cardiologist, as a physician, is to look out for the needs of the community as a whole, not individual people who may say feel like their quote-unquote rights are being violated. We have to look at things from a different perspective. I'll get on my high horse later about it. But for the short term, if you look at data in the literature, and I'm a data-driven person,
right.
And data in the literature says that masks do work to prevent the spread of COVID-19. And that's just the bottom line. But I understand people's perspective of, kids, what they go through. And I want to see kids thrive. But that's why they got virtual learning, too. If somebody feels strongly that they don't want the child to wear a mask, then consider virtual learning for your child. That way they don't have to be around other people. Because, again, the kids may do okay with COVID-19. Some of them do, some of them don't. But the bottom line is them kids are going to go home to somebody. And when they go home to somebody, they can spread what may not be affecting them to someone that it may affect them worse.
Yeah. So at what point, speaking of from the health and medical perspective, the whole idea of public health versus individual rights or individual choice, how does that weigh? And when should people really start looking at the collective? Because it feels like there's a lot of individuality going on here as opposed to looking at society as a whole and what we all want to do so that we can all get back to not wearing masks at some point.
Well, I think that's what the whole point. That's why I'm doing this Masters of Public Health program right now, just for this exact reason.
Yeah.
If you look at the current data is pretty clear. I did some literature searches prior to this, and I looked at the benefits of masking. If you look at it from a public health perspective, all the widespread data says that your risk ratio is less than 1, which is statistically significant. The masks do affect positively to prevent the spread of COVID-19, and that's out there in the literature. So when you look at it from a global perspective, what I'm trying to get people to understand is that which you do in an infectious disease respiratory virus, that is going to affect other people because you're breathing air into the atmosphere, and these other people are inhaling that same air you're breathing out. So if you have a bunch of little COVID-19 little thingies is trying to get into you, is going to be more likely you can potentially spread that. And that's the reason why this is so important, because it's a respiratory aerosol virus. That's why people are having the breathing problems, because that's the first place it's going to go into is your lungs. Mm-hmm. So under that circumstance, you're talking about what's the interest of the public as a whole, not the individual, because, again, look at how this spread has been. That's the issue that we're really trying to work through.
We got a very long email that I forwarded to you last night, Dr. Newby, from Jill, who has a child in Williamsburg, James City County Schools. And one of the things that she asked, I'm pulling this out of the email, she was hoping that you would address youth mask wearing and mental health problems of youth, mask acne, lack of oxygen for good learning, and stomach aches, headaches, nosebleeds, throwing up, all problems that she's heard are issues with kids wearing masks. Can you dispel or address any of those issues, all of those issues?
Well, I would say this. I'm sit on the board of one of the local schools that both has a elementary, middle, and a high school component. And, when the mask mandates came out last year, we enforced them in that area in those schools, and I haven't heard of any of these things she's talking about. So, I think when you look at it globally, I see kids in malls with masks on at restaurants, and they have little kids with masks on. I'm not seeing any of this type of stuff. Now, I'm not saying everybody. There are some people that may have some issues wearing a mask, but firstly, your oxygen levels are not going to drop, with a mask on. You may have some, depending on the type of mask you wear, if it's a N95 respirator versus a procedure mask versus a cloth mask is going to impact the work of breathing, because if you're blowing through, some material, you may have to work a little more, and that may be what she's referring to. But the bottom line is what you're looking to do is save lives and prevent disease spread. So, I hear them, and some kids may need some counseling or, some other aspects to help them deal with it, and I'm not dismissing that. But I'm still looking at the global good and what it's going to do, because, again, to think about it, if your child, think about as a parent, if you feel that this is no big deal, you send your kid to school and, no mask, somebody at the school gives your kid COVID-19, and suppose your child has a major complication or, God forbid, dies. Would you still feel the same way if it happened to you or one of your children?
Yeah. 440-2665 or 1-800-940-2240. Would love to hear from some parents out there. Are you sending your child to school with the mask regardless of the fact that it's optional, or have you decided, nope, they're going in without a mask? And how are you feeling about what's happening in the schools right now? 440-2665, 1-800-940-2240. Josh joins us from Newport News. Hi, Josh. You're on the air.
Hey, Barbara. I just wanted to say, great show.
Thank you.
I listen to you every Thursday. You're part of my lunchtime routine, and this is my first time calling in because I think that this is a great subject.
Thank you very much. So go ahead.
So I just wanted to say, and I was saying this to Dr. Graham while I was on hold, we have a 13-year-old, and as you know, 13-year-olds are very hard to get to do anything. But on her own, our daughter, and this probably stems from my wife being an ER nurse, she decided that she was going to continue to wear a mask, just not only for herself, but to protect others. So what the doctor is actually talking about is we really need to start thinking about let's follow the science. And nothing against the governor, but as we also know that a lot of this has become very political. And so I think if we just stick with trusting science, and if you don't want to trust the science, that's fine. But I think just trusting the science and being able to educate yourself and others. My daughter actually had a group of kids that were also going to mask up just because she was explaining to them the benefits. What if you go to see your grandparents? You could potentially infect them,
Sure.
And how would you feel about that? So, and I thought at the age of 13, so I'm going to brag on my kid, at the age of 13 to show that much initiative. But there again, it stems from my wonderful wife who, I think we have to trust the science. And, if you trust it, I think that we'll be better off. And that's really all I have to say about that.
I appreciate the call, Josh, and thank you for listening every week. And thanks for calling in. We really appreciate that.
Absolutely, and I hope I get to call in again another time.
Absolutely. Dr. Newby, he says follow the science.
Yeah, tell Josh, so he can try to give that credit all to his wife all he wants to. I think he's got to take a little bit of that, just listening to him saying, I want Josh, you my new best friend, boss, letting you know right now. If we have more people like you who understood, the aspect of, what is necessary to try to stem this thing and to keep it from, continue to expand and just to affect people the way it has been, we would be in a much better place. And unfortunately so, people are listening to non-scientists. Because, I'm going to tell you, Barbara, one of the things that keeps coming up is this aspect of, like, we as healthcare professionals there's no vested interest in us, kind of preaching this song. I mean, I'm not getting paid anything to try to get people not to infect somebody else. This is a public health issue, and we're public health professionals trying to assist in staving off a pandemic. There's no political motivations that any of us in the medical world have. At least not that I know. I don't have anything. So for us to sit there and just be making all this up for the sake of headlines, I mean, I don't want to wear a mask, but I do. And I do because I know what's necessary to try to help other people.
So even though the governor has said that this is optional for school divisions, or that parents should make the decision, is what he says. If you are truly against not wearing a mask, so in other words, you're really pro-mask, should you just send your child with the mask on anyway? In other words, will that help you? If I'm wearing a mask and no one else around me is masked, will I still have some sort of protection?
Yeah, you still have some protection. It's better when everybody's wearing them because, when you take that, you inhale and exhale. If you have a mask, it's like, especially if you had a respirator or a medical grade mask, then your particles are going to pretty much stay where they are within your realm of being. It's not going to go into the atmosphere to be breathed in by others. So it's always better for both. But if you have an N95, KN95, or some other medical grade mask, it will help you by wearing that mask. Yeah. So I would definitely agree with that.
And we'll talk a little bit more about the different types of masks in just a little bit. But we've got a line full of phone calls, so let's take a couple of them. I apologize. I hope I don't pronounce this incorrectly. I think it's Lakshmi in Norfolk.
Yes. Hi.
Hi.
Hi. Thanks for taking my call. Hi,
Sure.
Dr. Newby. So my question sort of stems, I'm a parent of a Virginia Beach school student, and the pandemic has disproportionately affected our Black and brown populations from the beginning. And now to put out a mandate that says you can wear a mask or not, and if you don't want to send your child to school, you can do virtual, which, by the way, is not actually even an option in Virginia Beach right now. And I feel like that also, by sending kids virtual because they don't feel comfortable with the mandate that was changed mid-year, is also disproportionately affecting some of our minority population. So could you just speak to that a little bit about how the crisis continues to be, effectively one-sided and disproportionate in many, many ways?
Wait. Thanks so much for the call. We appreciate that. Dr. Newby?
Yeah, well, if you look at, I agree with you in terms of midstream should not be the case if people have gotten their protocols in place. The issue becomes is, again, when you look at data-driven information, it's very, very clear the importance of mask wearing as it relates to spreading COVID-19. So when you look at giving people options, I mean, as a parent, fortunately, I'm a medical professional, but other parents are not. So to give them the ability to say whether or not their kids should come in with a mask, you're affecting those people around you. Then you talk about different households that may have different lifestyles. How many people may be in the home, can impact that spread. If you got like a 6,000 square foot house, there's only two of you there. I mean, it's not, that you can be in that house and not necessarily, one could be on one side, one could be on the other. But if you're looking at a 600 square foot place and there's 8 people in the house, you're going to be close corners. The potential for spread is going to be greater. So the disproportionality of it, by definition, is not going to help this situation right now. I totally disagree with the governor's position. I'm not going to worry about political aspects of this. I totally disagree with it because there was no science that went along with it. He made a mention in the mandate or his executive order, data shows masks don't work. I'm like, cite the reference. I want to see it, because I can show you a million references that say they do a lot. So I wanted to see a cited reference where they got that information from to say that they don't work, because I'm not seeing any of that.
Okay. Let's go to Karen in Williamsburg. Hi, Karen. You're on the air.
Thank you so much for taking my call. I'm really interested in hearing Dr. Newman point us to where we can see information on the percent of our school children who are now fully vaccinated. And I believe I saw something recently that broke that down by children in the 5 to 12 age group and 12 and above.
Dr. Newby, you know where she can go find that information? Is that listed on the CDC?
VDH, yeah. You can see specifically they have all the vaccination rates. You can find all that there, and in terms of who's gotten it and how many, what's the percentage of people who've been vaccinated. Because really, it's broken down, I think, and the CDC may actually have that as well, but I know the VDH does for Virginia, and I think for this being a local, show and local area, that we're going to really have more concern because, this is in the state of Virginia as to what those vaccination rates are. So that's where I would go.
Okay, 440-2665 or 1-800-940-2240. Let's talk to Jill in Williamsburg. Hi, Jill. You're on the air.
Hey, Miss Barbara. Thanks for taking my call. I appreciate it.
Mm-hmm.
And I look forward to you speaking at our library on February 2nd and meeting you.
Yes. So you were the one who wrote the email that I referred to earlier in the show.
Yes.
Okay.
Thank you. You're so sweet to read it and respond. I appreciate that. And I know we disagree about masks, and we could have citing wars. I'm not a scientist. I'm just a housewife. I think it's different. I don't know if you have kids who are right in the schools. It's a mother's instinct is like you're in the schools with them, and I have a teenager. He does what he wants to. It's really hard to get him to do anything. I love him. He's great. And the schools have been great as well. I do worry about how you punish somebody, a child, a 2-year-old, if they don't wear the mask, or what they do with separation or.
Okay, Jill, I think I know exactly where you're going. You're talking about what the school divisions are doing for kids that come to school that are not masked. And apparently at some of the school divisions, Dr. Newby, they have separated those kids and kept them in a classroom on their own as opposed to having them in the general population. So I think Jill is referring to, should we be making those separations?
Well, I think, I cannot say the right or wrong to this. All I'm looking at is how, when you look at this globally, how these actions may affect those around you. I don't think that necessarily that I would look at as punishment. All of it is about spin. If you have somebody in a different area, are you just leaving them in some classroom and not doing anything with them, or are you engaging those individuals more? Because they may actually, have a different perspective if it's spun differently to them, but just have to understand that, again, the lack of wearing a mask, you may affect someone else. And that's the part that I think I'm trying to push and emphasize is It's just not about you individually, but it's how you affect other people and what that effect could lead to. So I'm hoping that people understand it's not me being tough, mean. I don't care about anybody else. That's not the case. I care about people, which is why I'm so passionate about this.
Sure.
I just want people to understand that lack of doing it, and the parents need to understand that piece. Whether or not you agree, disagree, respect the science. Think about in your role, in your job you do. If somebody's coming there that you're expert at what you do for a living, and somebody who has no clue comes in and tells you should be doing it differently because they know more when they don't. How are you going to feel? You're not going to like that because you feel you're expert in this area. So this is the same thing I'm trying to make sure people understand. We have the background, the understanding, and the science behind us to be able to explain why our position is what it is. It's not to make anybody to separate anybody or to do any of that. It's trying to protect the community as a whole.
Yeah. And I heard this morning that there's a new variant of Omicron.
Yeah, I heard that too. But what that means yet, I always tell people don't get,
okay.
Let's wait and see what happens with that one. I don't want people to get nervous about that just yet. Be nervous, period, because of COVID-19. But I'm I'm going to wait to see what the data shows about this new variant.
Okay. Let's, if you're just joining us, we're talking with Dr. Keith Newby. He is a cardiologist and the director of health equity for Sentara, and he joins us once a month to talk about all things health. And we will talk now to Melanie from Chesapeake. Hi, Melanie. You're on the air.
Hi, can you hear me?
Yes, we can.
Great, thank you. Thanks for letting me speak. I am calling from Chesapeake, and I am one of the Chesapeake 13. We are a group of parents. Some of us are also public educators, but we are public school parents. I happen to have 2 kids in the public schools here, one who is 4 and cannot yet get vaccinated. He's been home with me for the last couple weeks because the numbers here with this new COVID variant are so bad. I'm very concerned about his safety, so I've had to keep him out of school. And we have a number of people in our group, not just in our group of 13, but in our wider parent group that has been petitioning for going on 3 years now at our school board meetings to try to keep all of our kids and all of our teachers and our whole school community as safe as possible. But we have kids and people in our family who, many of us have kids who are especially vulnerable, and you know, people in our family that they come home to that they could spread COVID to, and if they did, it might very likely be fatal.
Yeah.
So we understand on a very personal level that the threat that is there, and you know, frankly, I think that a lot of us are good, well, and fed up with parents who refuse to be considerate of other people and their vulnerabilities and refuse to teach their children to be considerate. You know, wearing a mask, the proper masks that are being advised to be worn by doctors now and by the CDC, you know, those do really work. And it's not a government conspiracy. It's a way to show other people that you care about them and that you want to keep them healthy and safe. And that's all just from a personal level. But I also wanted to say that what the governor's executive order does, it's illegal. It goes against our law. We have a law in place that was passed by the General Assembly last year that was based on Senate Bill 1303. And what that law says is that our school board should be given the authority individually to put all COVID mitigations in place to the fullest extent practicable. What that means is that it's the school board's responsibility to be making the best decisions, best based on CDC guidance. And let's be clear, the CDC guidance says that everybody over the age of 2, when they're indoors, they should be wearing the proper kind of mask, and that helps to prevent COVID. It's
Melanie,
very,
let me
very
ask you this. I know that your case, it is before the Virginia Supreme Court at this point. Is that correct?
Yes, it is.
Okay, so
yeah,
you're still waiting. Okay, all right.
We're still waiting. We have a number. Some of my fellow Chesapeake 13 went up to Richmond this week to meet with some legislators who are all backing us up, to meet with Senator Louise Lucas, you know, who's the president of the Senate,
right.
And to meet with our local delegate, Cliff Hayes, and some other legislators from across the state. Our lawsuit has also been backed up by the Virginia Education Association. That's the teachers union. And we're very happy to have their support. We're expecting to be backed up also by the ACLU, who represents a very large number of families who have kids that are affected by executive order number 2. And so, I mean, the momentum legally is growing across the state. There are 7 other school boards
Yes, we talked about that at the very beginning of the show. So we will keep an eye out and continue to monitor what happens with your lawsuit. I understand about your 4-year-old though. My daughter teaches nursery school, and they've had to shut down twice now because the younger kids can't get vaccinated yet they still become infected. Thanks so much for the call, Melanie. We appreciate it.
Yes.
440-2665 or 1-800-940-2240. So, Keith, let me ask you this before we go back to our calls. So should we ditch all of our cloth masks and only do the N95 or the KN94s?
Well, I think, personally, I went to the N95 personally and the KN95s. But that's me personally. There is data that says that if you double mask, like say if you had a woven or like 3-ply mask and a cloth mask on top of that would protect you more. But just a cloth mask by itself, especially with Omicron being so contagious, will not probably afford you the protection you're looking for. It's better to kind of upgrade, but it doesn't have to be an N95 because, they are a little more difficult to breathe through. In terms of that, but the medical procedure masks, N95s will keep the smallest particles they will block out. But if you kind of remember, you should keep moving. When I say that, don't sit in a room with somebody unprotected for any significant length of time. You need to keep moving. Now, I keep moving. I go in and see in a patient's room. I go over there and we'll fist bump, and I move to the other side of the room and start talking, and I do it very smoothly. So, I'm not even sure they realize what I'm doing, but I do my N95 because I'm in the room with them 15, 20 minutes. Sure. So, but I always keep a significant difference or distance, and I'm always moving, and I think that's the safest approach.
And so, while those masks, the N95, the KN95s, KN94s, are better than the cloth mask, any mask is better than no mask. Is that correct?
Correct. Okay. But just make sure if you do a cloth, if it's just a single layer cloth, that's not really affording that much protection at all. So, okay. I think if you're going to double it, that will give you a little bit more, but I'm recommending for Omicron at least a medical procedure mask or higher, and make sure it's fitted appropriately. It's better to have a wire on the nose so you can actually, push it down and you're kind of actually blocking things. And don't wear it under your nose. You're not doing anything with that.
I was going to ask you about that because you see so many people walking around with their mask around their chin or under their nose. But the whole point is to cover all of that, right?
Yeah, I tell them, I say, you just have that on for decoration. I said, what do you think that's doing? It's just, people just, I know they're doing it. See, people just don't really understand. They really just don't. So I'm trying to make sure that I do my best to help them understand. The whole aspect of when you have like the side of the mask, you don't want that buckled up, because those respiratory particles are going to escape on the sides. That's why they say they want a wired nose, because when you push down on that wired nose, you're creating a seal, and you want that seal so that things aren't escaping all over the place. So that's kind of the reason why. So just, if you have it, and people ask, well, I wore a mask, I still had COVID-19 anyway. I'm like, yeah, but you didn't really have it on. It was all over the place. I say, what do you think is going to happen? You're not putting it on appropriately. Now, you can still get COVID-19. Sometimes things will happen regardless. But what we do know is the best way to deal with it is your mask wearing, vaccination, social distancing.
Yes.
That will do more for you than anything else.
Absolutely. Let's go to Desmond in Yorktown. Hi, Desmond. You're on the air.
Hey, guys. How are you today?
Okay. How are you?
I'm all right. Hey, I know the good doctor is specialty is public health, but there's a political bent to this thing as well that's created a lot of dissension. Now, let me preface this by saying that my whole family is vaccinated, boosted, and we wear masks all the time. But after doing all that, my wife still got it. And me and my daughter did not get it. So the bottom line is this political bent is something that the governor ran on. He ran on that platform of not having mask mandates, and people voted him into office. So that's a problem right there. Number two, this nation and Virginia in general is bent on individual liberty. Those two things right there is not just to the doctor, it's about public health, but to a lot of people, it's not about public health. It's about you're trying to tell me what to do. And that creates a big time problem when it comes down to stuff like public health. Okay. So I'm kind of on the fence on this, and I don't know right or wrong. I don't really believe in mandates, but I do believe in putting my mask on and get vaccinated.
Well, I'm glad you believe in putting your mask on and getting vaccinated, because as Dr. Newby just said, that and social distancing on top of that are the main mitigating ways to try to stay as safe as you can. You know, Dr. Newby, I'll let you respond. Thanks, Desmond.
Yes. So I would say this, the political nonsense, politicians don't know nothing about medicine. Unless you're a doctor, trained professional, you don't know. So let me give you this I'm going to give you a quick perspective. I understand about this misconception about people and their individual rights, and people think that individual rights should supersede the greater good. Get it. But take into consideration this. This is why we have rules in this country. If I go in a residential section of town and drive 100 miles an hour in a 25-mile-an-hour zone, should I be able to do that because my individual rights should be that I should do what the heck I want to do? You know, I mean, to me, I look at going without a mask, giving somebody COVID-19 is like me driving 100 miles an hour in a 25-mile-an-hour zone. There are rules we put in place for a reason, and that reason is to protect the community. It's not there, you know, so it's like, okay, I will put on my seatbelt because the rules say that. Yeah. Should I be able to not? My individual rights, because my chest wall hurts, so I shouldn't have to wear a seatbelt because I feel like I shouldn't have to wear it. Try that and see what happens. You know
what? Actually, speaking of seatbelts, the Children's Hospital of the King's Daughters Chief Medical Officer, Dr. Christopher Foley, did an interview with Wavy TV, and he said, quote, "We wear a seatbelt in the off chance that you're going to be in a car accident. Most people are never in a car accident, and they're perfectly safe driving around. But you wear a seatbelt every day just because you can't control everybody else. The same idea with wearing a mask. You can't control who you come in contact with, who's walking around, what child is sitting next to what child. But if everybody is wearing a mask, we sort of limit the risk."
I agree 100%. 100%, 1,000%. Because again, that's where that supersedes those individual rights, because it's not about you, it's about everybody. So that's the part I've tried to get people to try to take yourself out of yourself and look, because it's interesting how people will sometimes not see when they're selfish is okay. If somebody does something to them they feel is selfish in the other person's favor, they have a problem with it. And I'm like, wait a minute, it doesn't go one way. This is about everybody. We live in a world, we don't live in a vacuum. We live in a world surrounded by other people, and we have to be cognizant of other people. That's the whole Christian belief system we have, or whatever you want to believe in. But I guarantee you, any religious sect you're in, any organization you're in that with the idea of respecting other people as well.
Right. 440-2665, 1-800-940-2240. Tom joins us from Hampton. Hi, Tom. You're on the air.
Good afternoon. I'd like to say, do a comparison of these individual rights and mandatory rights that I think the politicians are elected to perform. And an example of that would be with the coronavirus, approximately 2,000 people a day was the last numbers I heard are dying in the U.S. every day. And you take that as and we have a known cure that can, eliminate most of those deaths. But in the case of something like the 737 MAX, where we had maybe 600 people get killed worldwide, but they took the entire fleet off. Now, there was the politicians and whoever else was in charge in the government that had the ability to make that decision, made that decision to keep the public safe. Now, I don't understand why at this point, when we're seeing 2,000 deaths a day, they can't make that decision to say this is the fix and we need to mandate it.
Gotcha. Okay, Tom, thanks so much for the call. I'll let Dr. Newby respond to that.
Well,
and I don't want to get into politics, Dr. Newby. You're a doctor.
I'm not sure. I don't know of any cure that's out there.
Right.
I know there are preventative measures out there. That I know for sure, but I don't know any cure that's out there because you can't. I've never seen anybody get cured from a virus per se. I mean, so you can it can wear off. After a while, it runs its course. But the bottom line for me is it's not about politics. It's about medicine and science and caring about your fellow man. That's really what it boils down to.
So speaking of medicine and science, is there a fourth booster shot coming?
It's a good question. I mean, I'm sure there will be at some point in time when, there's a lot of variability in that because we don't really know. I can tell you this for fact, though, is, I can say this through just personal experience because I work in the hospital every day. When you look at, when I remember last December, when the vaccine was first kind of starting off, that December, January, it was kind of like the medical people were getting it at first and what have you. Uh-huh. But when it was becoming a little bit more widespread, that was kind of March, April, I saw in the hospital this sharp drop in hospitalizations starting like in April, kind of middle March, end of March, and into April. Mm-hmm. I was averaging on my personal service at least 8 to 14 patients every day with COVID, and I'm a cardiologist.
Wow.
So that was average. So I saw this by May, I had 1 in the hospital. By June, I had none. July, I think I may have had 1. Then Delta started coming out, but I only saw a slight increase hospitalization-wise. Omicron was really when things really kind of took off again. But when you look at vaccination rates, everybody I've had since the vaccine has been out, and I'm not saying this for anything other than the truth, the only deaths I have seen personally, and I emphasize personally, has been in the unvaccinated group. Only one. Everybody else, all the vaccinated people, may have gotten COVID, but I didn't see many of them in the hospital, and I haven't seen any of them personally pass away.
Let me ask you this, Keith, too. A lot of businesses and venues and so forth have restrictions where you can't come in unless you're fully vaccinated. So now that Omicron is as contagious as it is there really a difference between if the vaccinated and the unvaccinated get together, all in the same space? In other words, do we still need to keep that difference being vaccinated versus unvaccinated?
I mean, personally, I still feel that way. And, okay. I mean, but this part is more anecdotal to me than it is data driven, and I always preface everything. If I have data, prove something, I'm gonna say studies show this. Uh-huh. This is more anecdotal because I'm looking at just trends that I see. The bottom line is because Omicron is as contagious. See, this is the thing. I don't like being sick. Period. Me
either.
I don't like being sick. Period. So although people that have gotten Omicron has not been as severe in most people, especially the vaccinated ones. Mm-hmm. You're still a crapshoot. You don't know what's going to happen if you catch it. So why take that risk? That's why. I mean, I still haven't done a whole lot of going out anywhere. I mean, I do some, but not. I mean, I'm working home and what have you. But I mean, I do some things, but I'm very cautious and I'm always have my mask on anywhere I go. I think if we stick to our general rules, then it's
not time to relax that yet.
Yeah, I wouldn't relax at all yet. We're seeing some trends in Omicron starting to drop a bit.
Right.
But if you start getting too relaxed, that's when it's going to kick right back up.
Would you also explain, because at least from and again, this is anecdotal, but from friends that I've spoken with who have gotten COVID, even though we say the symptoms are milder, they still are pretty sick.
Yeah. That's what I'm saying. I mean, you're just not dying in the hospital, because when you look at somebody this COVID, when COVID was really, bad. I mean, I never get nervous in the hospital dealing with sick patients. I was at Emory in Atlanta when I was an intern resident where HIV was rampant then. And but it wasn't, we still didn't know, everything about HIV, how it was transmitted, what have you. So you get these sick people coming in with brain infections and, these pneumonia infections, and they were all with these what they call opportunistic infections. So we didn't really know a lot then, but I didn't get nervous then. This stuff can make you nervous because you see these people dying, and when they die from COVID-19, it is not a pretty death. I mean, it's sometimes it could be fast, and sometimes it could be slow and drag out. And I've had a couple of good acquaintances that passed away that were in the hospital for almost a month, steadily just getting worse and worse. And you see the kidney shut down, liver shuts down. I mean, why take that kind of risk? Because you just don't want to wear a mask. Personally, I'm a chicken. I ain't gonna lie on that one. I mean, you call me cluck away. I mean, I refuse to get this virus because I didn't try to prevent from getting it.
Okay, so we got about a minute and a half left. So let me ask you, first of all, is there anything surprising you've learned thus far in your public health work that you're doing now in terms of your next degree?
Well, actually, I'm gonna tell you, it's tough because I got like 3 jobs. I'm a full-time practitioner. I'm doing the work for Sentara, and then I'm doing this public health program. But I'll tell you, it's fascinating stuff because it makes you look at the world differently than what you did originally. I mean, because when you're coming from a scientist, medical perspective, the world is seen through a certain set of eyes. But public health, you have to look at it because now you're taking into account other people and their cultures, their backgrounds, how they live impacts and what's considered a public health problem. The statistical part, I'm learning all this stuff that's actually intriguing. So I would have to say I enjoy this new process and this learning a new area of medicine that I didn't know before. So, it gives you a different perspective, no question.
That's fantastic. Okay, so last 30 seconds, 3 things people need to do is mask up,
get your vaccine and booster, and wash your hands, and watch how long you're in rooms with people. Don't let that guard down. Be proactive. Understand that what you do impacts other people.
Else. Thank you so very much, Dr. Keith Newby. He is a cardiologist and the Director of Health Equity at Sentara, and we'll be right back.
I'm with Marcellus, and you all are checking out Another View. Don't go anywhere. Check us out.
And welcome back. If you've ever seen the word ham, H-A-M, scribbled at the bottom of a huge mural gracing the side of a building, you're about to meet the artist. His name is Hamilton Glass, and while his work has been featured in Norfolk's Neon District, the bulk of his colorful creations grace the building after building in downtown Richmond. Our Lisa Godley recently spoke to the Hampton University grad about his talent for bringing community stories to life through art and what it takes to do things really big.
At 40 years old, Hamilton Glass is already well into his second act. The Hampton University graduate started Act 1 as an architect. 8 years later, his passion to tell community stories through vibrant paintings on large concrete canvases took control. For example, in the 3000 block of Richmond's Chamberlain Road, a red, white, blue, and gray painting covers the side of a 3-story building. It features 2 black women so entwined in the American flag that it's part of their physical makeup. It almost appears they're adorning red and white striped hair on one side and blue hair with white stars on the other. Hamilton named his creation Struggles in the Ruffles.
Really, that piece is about embracing the trauma of America, knowing that it will never be perfect, but we built this place, and there will always be a struggle for us here in America.
He says while he enjoyed being an architect, it was never his passion.
When I lost my position as an architect, the thing that I did was I started creating art, and I started showing it everywhere.
It didn't take long before individuals, organizations, and corporations started commissioning his work.
When I'm commissioned to do a piece, usually we go through several design iterations of the work and revisions of the work. And then once that's complete, it's really just production time. I first go up, sketch the piece on the wall or the panel, and then just paint till it's complete. There aren't many things that take more than 2 weeks.
While Hamilton has created scores and scores of murals and had his art featured in numerous exhibits and at dozens of public events, the piece that started it all was one he created for the organization Girls for a Change. He was moved when he heard the young women speak at a public forum about seeing themselves represented in a different light.
Getting to see the joy in their faces and to be able to put out something that truly represented them in the city, that everyone could see and carry the message of Girls for a Change was just a kind of a life-changing experience for me also.
I asked him why he tags his pieces ham with a question mark.
My website is whosham.com. So that was the very beginning of me trying to figure out who I was. And actually, Hamilton is my middle name. My first name is Maurice, but the second I became a full-time artist, I've gone by Hamilton because it's this other side of me in which I've never explored.
As you might imagine, painting while scaling the side of a building has its challenges.
Being a public artist, you often have to paint in not ideal weather conditions. I've had to paint on a rooftop when it was 100 degrees, which means it's probably like 115 up there. Sometimes I have to paint in the cold. Just 2 weeks ago, I was painting in 30-degree weather. This summer, I did a piece here in downtown Richmond, which was 60 feet up in the air. And the parking lot was on a slope, so it was this little rickety little boom lift, which it's always swaying back and forth. So there's a lot of conditions in which you don't get to paint. I love this responsibility and semi-power that I have in being able to control a narrative through my work. 50 years from now, I'm hoping people really understand the intention that I put in my work. Most of my work is not about me. It is about using art to solve a problem, to help a community, or to address a need, because art is a really good tool at doing that.
For Another View, I'm Lisa Godley.
And Hamilton Glass is also the creator of the Mending Walls Project, which brings artists from different backgrounds together to have conversations about social and racial justice. Then they use what's discussed to create a piece of art that inspires empathy and connection. No matter what side of the masks in schools debate in which you fall, I hope that you remember that civility and respect should be at the core of your discussions, and that as adults, we set the tone for acceptable behavior in our children. You can listen to this show again or share it with a friend by visiting our website, anotherviewradio.org. I hope you will sign up for our eView newsletter. It's a once-a-week reminder of upcoming shows. And next week on Another View, come meet Drayden, life and challenges African-American families face when raising a child with autism. And want to again remind you that we are doing a town hall on bridging the education gap. It is on February the 10th. Go to whro.org/community and sign up. And I hope to see you there. It will be at 6:30 p.m. on February the 10th. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer, and Dr. Barry Graham answered our phones. Until we get together again, be positive and test negative. I'm Barbara Ham Lee. Looking forward to chatting with you again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever, whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.
Support comes from Thomas Nelson Community College, now becoming Virginia Peninsula Community College, the first choice to start a career. Gain skills in fields like cybersecurity and education. More at tncc.edu.